I'm Dr. Bowers, and in this video I will be discussing doorway stretches for the shoulders. Stretching can cause injury if done improperly, and some medical conditions make it more likely that someone might injure themselves stretching. You should likely not do these stretches if you have ever dislocated your shoulder, have had rotator cuff tear or sprain, or had recent trauma or surgery in the area being stretched. Always make sure your physician or bodywork professional has deemed an exercise or stretch safe for you. What is okay for one person may cause serious harm to another person. So let's talk about some rules for stretching muscles if that is something that a healthcare professional has instructed you to do for this shoulder area. Number one is only do it if your physician or a bodywork professional has instructed you to do the particular stretch. 2, stretches should not hurt ever, okay? So stretching should be to tension and not to pain, which means when you go into the position, you should do it slowly until you just start to feel some tension, and that's where you're going to want to stay. You don't want to push on through to when you feel pain, because that actually activates neurologic reflexes, which will cause the muscle to want to spasm, and that's not going to be very helpful when you want to stretch it out. Number 3, only hold muscle stretches for 30 to 60 seconds maximum. Stretching out something like a scar tissue or some kind of a fascial restriction is a little bit different than when you're stretching out a muscle. A muscle has a requirement for blood to be coming to the tissues and delivering oxygen and nutrients and taking away waste products. And if you hold a stretch too long for the muscle and it's not getting those things, it's likely to end up spasming, and once again, that is not helpful to our purpose of stretching out the muscles to get them to relax. 4, slow, deep breaths can help to stretch and relax the tissues that we're working on. Let's start by discussing a general stretch for muscles that attach to the anterior or front part of the shoulders, and that could include pectoralis major and minor, coracobrachialis, subscapularis, teres major, or anterior deltoid. Depending on which muscle is being stretched, the patient may feel the tension in their upper chest wall either anteriorly in the front or laterally on the sides, or they may feel it in the front of their shoulders. Placing their hands on the door frame at different heights helps you stretch different muscles. So you may have your hands a little bit higher than shoulder height on the door frame, or you may end up putting them higher to get different muscle fibers. To start, find an open doorway and stand just in front of it, and place your hands just above shoulder height on the door frame. Then you want to shuffle forward until you feel a stretch in your chest or ribs or the front of your shoulders, making sure that you don't go so far that it causes pain. You just want to feel that slight beginning of tension. If you don't feel any tension or stretch in this position, then back up, move your hands a little higher on the door frame, and shuffle forward again. Keep trying this until you find the right height that allows you to feel the stretch of those tight tissues. You can look straight ahead for the whole stretch, or you can try turning your head one direction as far as it will comfortably go for 10 to 15 seconds. And then you can turn it to the opposite direction for 10 to 15 seconds. This sometimes allows you to stretch out different fibers of the muscles that you wouldn't normally be able to do if you were just looking straight ahead. Regardless, make sure that for the whole 30 to 60 seconds, you're taking nice, slow, deep breaths. When you're done, step back through the doorway so you can easily and comfortably lower your arms. Now let's watch the steps in motion, remembering that while this video is only a few seconds long, in real life you would hold the stretch for 30 to 60 seconds. The latissimus dorsi is a large back muscle that attaches to the anterior shoulder and can affect it. but it needs a little bit more specific positioning in order to isolate and stretch that muscle. So when this muscle needs to be stretched, you need to do it with only one arm, one side at a time. And what you do is you place your palm as high up as you comfortably can on the door frame, shuffle forward and a few inches beyond the doorway, but don't go so far that it hurts. Turn your body away from the doorframe until you feel tension, not pain, in the top front of your arm where this red star is, and then take slow, deep breaths for 30 to 60 seconds. You can take some breaths looking away, like in this picture, or looking straight ahead is fine, whichever helps you find the tension where the red star is located in this picture. When you're done, step back through the doorway and lower your arm, and if you need to, you can stretch the other side by repeating the steps on that other side. Now let's watch a video, remembering once again the video is much shorter than the 30-60 seconds that you would ideally want to hold this stretch for. I have made these videos as a resource for other physicians, body workers, and my patients. I cannot recommend that you personally do these stretches unless I have examined you, obtained a thorough medical history, and deemed them appropriate for your individualized healthcare needs. It is only safe for you to do these stretches if you have been instructed to do so by your physician or body worker.